As we're seeing here a 19-year-old student in London infected with acanthamoeba with her contact lenses from city tap water. It was treated with single therapy, then double therapy. Unfortunately, not steroids employed early enough. A year later, we have this very significant anterior stromal scar. And this is the placido dystopography underlining the significant irregularity that scarring causes to the cornea and dropping her best corrected visual acuity to 2200. And let's see what we did in the laser room. This is our laser room in Athens, the Alcan refractive suite and the VisionMax 800. So indeed, a very, very difficult case to treat. But let me go back to scarring. We can see that most of the scarring is anterior, and the anterior cornea surface is very irregular. You can see this big indentation here, and there's one more here. So in laser terms, with the placido dystopography, this would have been her treatment. So let's go and play a little bit of the treatment. So the refractive error was -2 rather, -1.5 at 74. And this is what the topography-guided platform will do in the US as well. Let's take out the refractive error to see what the actual normalization of the cornea is. And we'll look at this in comparison to the topography maps. So you can see that the laser is going to try and treat around this flattened area in order to make this area become elevated. And at the same time, since this treatment takes away most of the anterior stroma, the central cornea anterior stroma, will take out scar. Now we put the refractive error as well. So if we treat -2, -1.5 on top of the topography guided treatment, let's dial in -2, -1.5. And a little pearl here that we repeatedly published is that you need to adjust the axis to the topography axis, not the refraction axis, because of TMR. So this is the treatment, and let's point at the area of the scar here. This will remove 69 microns of stroma. So take away most of the scar that we saw on anterior segmental CT that we can also see here. So the epithelium and an additional 60 microns of stroma. So this is what we actually did. A year later, we can see that most of the scar is gone centrally. We've gone from 2200 visual acuity to 2020 minus. We can see on anterior segmental CT that indeed most of the scar, the anterior stroma has been removed and along the scar as well, but also the anterior stroma surface has been smoothened. It doesn't have that big indentation it had prior. The epithelium is relatively normal, and here are the drastic topography changes before and after, and the difference. And the difference is really underlining the topography-guided ability to reshape the cornea, normalize the cornea, and at the same time, by removing anterior stroma, attain removal of most of the corneal scar. So let's go back and again look at the topography-guided Contura and outcome terms treatment plan, and how if I set refraction for 0, and this is again the difference maps top right before, bottom right after, and the difference on the left, and the postoperative anterior segmental CT showing the epithelial remodeling and the removal of most of the anterior stromal scar